In this video, I'm going to discuss how crucial nutrients from your diet can support the fetus development during pregnancy and how methylation cycle can affect the health of the mother and the newborn in a multifactorial way. During pregnancy, mothers are either prescribed or asked to consume 800 micrograms of folic acid. And this is a huge thing, huge problem. First, folic acid is not folate. Folic acid is only a form of folate. Folic acid is synthetic and is not naturally found in the environment. When someone is given tons of folic acid or eating a diet which is highly fortified with synthetic folic acid, it begins to slow down their methylation cycle. Preferentially, you want at least 80% of the serum folate to be metafolate. The folate receptors can be easily blocked by synthetic folic acid because these protein receptors has a higher affinity to folic acids. And since metafolate and meta-B12 are both required to run the mTR genes to methylate homocysteines, if this path is blocked, they will affect the production of your SAMe downstream. And SAMe is the primary meta donor, which involves in more than 200 over chemical reactions. And do note that we have not even determined whether you are someone having this MTHFR polymorphism or if there's any mutations in the genes within this methylation cycle. Okay, if I shift to this new chart which I just created recently, we can see that high maternal stress can lead to a series of issues. Stress of any kind can increase your stress hormones. They are like your epinephrine and norepinephrine, and the conversion of this epinephrine requires SAMe, as shown over here. Technically speaking, more stress means higher demand for SAMe. So on the other hand, epinephrine can also deplete your dopamine and may result in symptoms like lack of motivation and difficulty in concentration when there's issues with your dopamine level. Stress hormone can also wear down your adrenal glands. If you're constantly under this sympathetic nervous state, as shown here in the circle here, the cortisol, which is secreted by this adrenal gland cortex, can continue to send negative feedback within these HPA axis. And this cortisol is actually helps to allow this fight and flight mode to last longer. But cortisol dominance over time can cause this state to become catabolic, whereby the body is breaking down things, and this can suppress gastric emptying and slow digestions. And we often call this a pro-survival mode. Slow digestions and mineral deficiency can then cause these vicious cycles to spin even harder. Okay, we shift over to this methylation cycle. Under typical situations, 80% of your SAMe is being used up by PMT and GMT for the production of your phosphatidylcholine and your creatine. When the body is under stress 24/7, cortisol will push this methylation cycle to make more stress hormone. And instead of making this phosphatidylcholine and creatine, you are creating more stress hormone. Do you see where it goes now? When the methylation cycle is being disrupted, the mother will have a slower PMT to produce phosphatidylcholine. And as you can see from the list over here, phosphatidylcholine is very crucial, especially when you are pregnant, because you will need extra phosphatidylcholine to make new cells for the baby. And phosphatidylcholine also helps to package and transport triglycerides out of your liver. Therefore, when there's low phosphatidylcholine, you can lead to an increased risk of fatty liver. And also listed some of the lab markers you can look for in the bottom of the screen here, which can help you to detect early fatty liver. Phosphatidylcholine is also the major phospholipids components for your bowel productions. When your bowel flows very sluggishly, it can reduce fat absorptions, especially your fat-soluble vitamins A, D, E, and K. Then bowel salt has these antibacterial properties which can help to eliminate toxins and prevent small intestine bacterial overgrowth. So on top of the PMT, you also affect the GMT, which is your creatine productions. And this can affect the low birth weight for newborns. And low birth weight is associated with a lower IQ. And also included these studies for you to go through. Creatine deficiency can also lead to a speech delay development, which is often seen in most autistic children nowadays. Not only creatine can have effect on newborns, but also the mothers. they may experience slower recovery, body aches and pains over here. And also with someone with a lower creatine, they might have a lower exercise tolerance and they may take a longer time for the recovery. So with the reduced activity of PMT, GMT, together with a poor methylation cycle, now the risk of getting miscarriage, preeclampsia, and cholestasis will go way up. Another common issue for pregnant mom is gestational diabetes or obesity. And this can be caused by eating too much carbohydrate and sugar. And it can be manifested by insulin resistance and other related hormones. And one of the hormones, which is this leptin, it can actually inhibit signals acting to the brain to stop eating and increase energy expenditure when the body is full. Both gestational diabetes and obesity can also increase the chances of delivering the baby via C-sections. And this further increases the risk of preeclampsia. Newborn babies born in this way are also more likely to have issues with autism, neural tube defects, and their gut microbiome has lower diversity of bacterial composition. This can affect the infant's immune system development later in life. Furthermore, if there's no early interventions or support for the postnatal neurodevelopment, it may lead to future early onset dementia and other complex cognitive issues. So as you can see over here, estrogen can also stimulate PMT. Because during breastfeeding, the hormone prolactin can suppress your estrogen level, which explains why some postpartum moms tend to have gallbladder issues. And to some degree, they might even experience muscle weakness, poor memory, and accumulation of their triglycerides. And if you shift over to the bottom left over here, we will see some of the screenings. These screenings can be useful. Okay, we do have some very basic conventional testings like the comprehensive metabolic panel and the complete blood count. And these tests are usually easily available in most regions, most countries. Whereas these functional lab testings listed here are slightly less available, especially where I live now in Singapore. But fortunately, these tests are accessible through functional practitioners and they tend to drop ship to most countries. So they are pretty accessible. My favorite screenings is this stress and hormone test and the GI map, which tests for your pathogens, your parasites, even if someone having this candida overgrowth. This can be tested through your stool testings. And the organic acid test can test a lot of these metabolites which your body use and are being excreted through your urine. Ultimately, these tests are just another tool in your toolbox. You have to find the right person to interpret the result and help you link the dots and look for patterns. You do not want someone to just come in and treat the paper, treat the result by giving you a pill for an ear or maybe a supplement for symptoms. Do you agree? And in worst cases, if your doctor is not testing, they are basically guessing. And I also see that some doctors don't order some tests that patient requested. Basically, one of the main reasons is because they are not taught how to interpret them correctly. And if you shift over here, I listed some of the most common drugs used to manage acid reflux. Okay, and your diabetic medications, and for some ladies who wanted to prevent pregnancy in the early stages, all these medications can actually affect your methylation pathways. Both antacids and proton pump inhibitor usually being prescribed by doctors when someone's having this acid reflux. They tend to deplete your vitamin B12. Metformin is a common drug used to manage type 2 diabetes, and this can decrease your vitamin B12 absorptions. The medications methotrexate usually used for cancer patients to slow down the growth of certain cancer cells, can slow down these DHFR genes. And in order not to further slow down this gene, removal of synthetic folic acid is a must. Oral contraceptive pills can deplete folates. And as we know, one of the essential functions of folate is for DNA synthesis. So if you stop and deplete the folate level, you're not able to synthesize DNA. And nitrous oxide, also known as laughing gas, is often used as sedative to help you relax during procedures. But it can slow down this MTR, methionine synthase gene, which acts as a methylation regulator. So in order to support your methylation cycle, you can utilize the 3Rs approach. First, you have to remove the known sources, all these known stresses, the most obvious one, which is coming from your food. You can try to remove your wheat, soy, corn, and dairy. You may also want to remove all commercial vegetable seed oils and heavy metals such as this arsenic, lead, and cadmium. All these can be found in your rice, your apple, and your water. So in terms of your water, because we tend to consume quite a lot of water, it's best to so-called invest in yourself with a decent water filtration system. There's also alcohol and fermented food like your sauerkraut, all this milk, kefir, bacon, processed meat, and hard cheese, which can increase histamine levels in your body. You should always discard anything that contains synthetic vitamin B9, which is your folic acid. And I often see this cyanocobalamin, which is a synthetic form of vitamin B12 in supplements nowadays. Supplements that contains these two vitamins, you should discard them and should not consume them. Because once you consume them, you actually slow down certain genes and enzymes. Stop using all these non-stick cookware and opt for more safer materials such as your ceramic, your stainless steel, your cast iron, or even more premium like titanium. If you are staying in a moldy room, you really have to remove yourself out of the environment. You can do everything correctly, but if you are still staying in the moldy environment, you can't heal your body. The second R is to reduce. These are the stuff are usually harder to remove completely because it's so prevalent in our environment. But you can reduce as much as possible when you know the danger of it. These are the examples like the phthalates from your skincare and cosmetics, the commonly found in your nail polishes, your perfumes and your shampoo, or even household items like your shower curtain, your gardening hoses, your tubings, storage containers, adhesive, and sealants. While you can stop using all these non-stick cookware, you should also avoid or try to reduce using all this grease-resistant food packaging, which contains PFAS or forever chemicals. And this can be found in stain-resistant clothing, waterproof clothing, and it can also be found in your tap water. So I say that water filtration system is a must because you want to remove all these heavy metals, your PFAS, all this, even your chlorine and your fluoride. You want them to be out of your water because you drink them almost 2 liters a day. The BPA from cash receipts and plastic containers, and also avoid getting mineral water from plastic bottles because the study shows that 1 liter of water contains approximately 240,000 of microplastics and 90% of it is nano sizes. Reducing inhaling too much toxic pollutant. These are your exhaust fumes, your cigarette smokes. And avoid using pesticides and herbicides in your backyard or your garden. Fruits which are heavily sprayed with, such as glyphosate, should also be avoided. If you are not sure, I've included a link to this EWG website, and you can look for the Dirty Dozen list. Newly painted walls and furniture also off-gassing formaldehyde and volatile organic compounds. If you experience nausea and vomiting upon entering to these compounds, usually in a poor ventilation room, you should get out as soon as possible. Air the area for a few days or weeks until it's completely safe for you to enter and to stay inside. If you are doing some sort of testings, which are all the screenings like your GI map, you may also find out there about your gut bacterial ratio, and some bugs can produce acetaldehydes and histamines. This also gives you a clue why some kids experience symptoms similar to alcohol and histamine overload. All the above can create a lot of oxidative stress in your body. So reducing all these toxicant exposure and wrong food choices can greatly reduce a lot of burden on your glutathione cycle, which helps to spare crucial nutrients for other pathways. The last R will be restore. So basically you want to provide your body with all the good stuff, all the vitamins and nutrients, the minerals. Eat nutritiously by getting more nutrient-dense food. Higher quality protein intake, usually from animal-based. Although plant-based have some protein, but they are usually incomplete. and they come with tons of anti-nutrients. So I won't really highly recommend on getting a lot of your protein from the plant-based. You should always also go for some healthy fats like ghee, butter, or beef tallow, animal fats. And essential fats such as your omega-3 and omega-6 in the proper ratio of not exceeding 1 to 4. And maybe a small amount of clean carbohydrates, because too much carbs can cause insulin resistance. And sometimes when you consume too much sugar, it'll make you more cranky. You should also eat a high choline diet during pregnancy, because according to a meta-analysis of 12 prevalent studies, only 11.24% of the pregnant women worldwide consume adequate choline intake. Choline can be found in your eggs, your meat, fish, and poultry. Don't be afraid of high cholesterol food. You may want to check out the cholesterol on the link over here. Again, eggs are your best choices because it contains both choline and cholesterol, which provide tons of support for your cell membranes, bowel productions, and your neurotransmitter, your acetylcholine. Restore a good sleep and adequate exercises. During pregnancy, I'm not recommending you to go for heavy intensity exercises, rather than more of the movement. Move around. When you move your body and create heat, it helps a lot of your detoxification pathways. Basically, you want activities that makes you move around rather than sitting on a chair whole day. You should always get all your nutrients, all your vitamins and minerals from the food sources. Do not go for the supplement route unless it's really needed. For example, if you're someone staying in a very north or there's limited sunshine, so you should always maybe supplement your vitamin D3, and only supplements when needed based on the situation you're going on. If you're going on a very stressful situations, then you get more nutrients. And if you can't get nutrients from the food, then you supplement. And if you're on holiday and on a relaxed mode, you just skip all these supplements because you do not need all these nutrients as much when you are more stressed. Other beneficial implementations that you can incorporate will be breathing and various ways to stimulate your vagus nerve, such as your humming and gargling of water. When you are in a parasympathetic nervous state, most of the time, now you can digest and absorb all the nutrients better. Then you have all the cofactors needed to run your pathway very smoothly. Okay, we have come to the end of this video. Remember, you have to chew your food properly and avoid eating while watching TV or eating while driving. If you have not watched my previous video on methylation cycle, do click here